Hello, I want to share a follow-up to my previous video where I explained what functional medicine is from the viewpoint of fibromyalgia. Now, I'm not a fibromyalgia expert per se. Somebody had just recently asked me about this, and so it was on my mind. Now, my area of expertise is endocrinology, so I've been treating for more than a decade metabolic syndrome, PCOS, diabetes, thyroid, weight gain. And if we look at it from that point of view, if I explain it from that angle, let's take diabetes, for example. In the traditional model, the way medicine is practiced here, a patient is given a diagnosis of diabetes. One of the ways is the hemoglobin A1C has reached 6.5% or higher. And then they are placed on the appropriate medications. Now, we do offer lifestyle changes and nutrition advice, but we don't have as much time to spend with the patient as we would like to. If we look at diabetes, we look at the root causes. Number one, it could be lack of exercise. It could be poor nutrition, eating a lot of sugar, etc. But there's other factors as well that we would look at. So we would look at genetics. We would also look at gut health. So when the microbiome is not balanced, it can lead to insulin resistance in the body. So we look at a lot of these different factors. Even, is the body toxic because a person is constipated? That's one of the ways that the body eliminates toxins. So I ask this question when I see patients with all of those things that I mentioned, and most of the time they tell me some kind of version of IBS. So I might start working on their gut health rather than rushing to put them on medication. Now, one thing I'll say is I'm not against medication. There are so many good medications out there now for diabetes when there used to be only one. And even the GLP-1 agonists, those work amazing for some people. And basically they are a peptide hormone that the body is not making enough of. So I do often use those. My goal would be to get patients on the least dose that they require. Eventually, I would love for people to be able to come off of them because their body is balanced. That's the ultimate goal. The other thing is when we look at these things like diabetes, PCOS, weight gain, and all these situations where there's insulin resistance, there is a relationship between insulin resistance and pain in the body. And also there's a correlation between inflammation and obviously pain in the body, but also insulin resistance. So it's all related. And oftentimes when we get to the root cause, all of the things get better. So that's the kind of approach that I like to take when supporting patients, in all of these scenarios. As you can see, I'm at the airport. My flight has been delayed, and I will probably see you all in 2 weeks, unless I post while traveling. All right, take care.